Hi, I'm Dr. Gobi. Under the family health expenditure, today I will talk about the complications of diabetes. When a diabetic patient is having diabetes for a long time, like 10 to 15 years, if the blood sugar levels are not well controlled, the micro and macro blood vessels would change. Those changes will cause a lot of issues. First of all, if we take the eyes in the retina, the micro blood vessels tend to rupture and cause bleeding, leak of fluids. So when time goes on, those blood vessels around the blood vessels will get new blood vessels forming, called proliferative diabetic retinopathy. And then these things will lead to ultimately to blindness. Many young people are getting blind because of diabetes all over the world. To prevent this happening, the blood sugars have to be controlled properly. It's a long term process. Once these changes happen, the ophthalmologist would do various treatments. So, when a patient is diagnosed with diabetes, it's better to check the eyes, sending them to the ophthalmologist. If there are changes found, the ophthalmologist would treat with some medications. For the ruptured micro blood vessels, he might do laser therapy to coagulate them. If there are issues like retinal detachment or vitreous issues, he may do some ophthalmic surgery to correct it. Um, but prevention is the best thing. So this involves, going to the doctor and then maybe hospitalization, ophthalmologist, various procedures, all very expensive. If the patient is not under the healthcare insurance, then of course the patient has to pocket it out, and it involves thousands of dollars. In Sri Lanka, of course, the state hospitals, government hospitals do it freely. But unfortunately, the patient has to wait for a long time for these treatments. If it is in the private sector, it's very, very expensive. In Canada, of course, in Ontario, the Ontario Health Insurance Policy covers most of these treatments. But anyway, if the patient is affected, then the family is affected, the patient has to put leave and then go to the doctor, and it affects his productivity also. So a lot of issues are involved. Then even medications in Canada, of course, not the elderly or the young people have to pay for it. So involves a lot of funds. Then, of course, the second thing is the nerves. The nerves are also damaged because of not getting proper nutrition because of the blood vessels changes. So, the patients get peripheral neuropathy or proximal neuropathy or autonomic neuropathy. In peripheral neuropathy, the patient suffers from numbness, tingling in the hands and feet. And proximal neuropathy, muscle weakness, and the autonomic neuropathy, patient will get bowel diarrhea or loose motion, bladder control difficulties, and then dizziness or giddiness, and then in the heart, of course, the heart may not be beating properly for the patient's activities. So various issues come out from that too. uh, and also the impotence because of in males there will be erection problems, and females also dryness of vagina and so on. Um, so these things have to be treated by a specialist. It all involves a lot of funds. The patient also, sometimes if the patient is getting dizziness or giddiness, driving is an issue. If the patient is working in construction or working in other heavy duty jobs, they this will interfere with their jobs. And then the main issue is the kidney issue, where the glomerulus, which filters all the bad products from the body, tend to get damaged because of the blood vessel changes. So gradually it may leak, albumin in the urine. So this we have to check the urine of the diabetic patient to see whether there is albumin. And we also do other battery of um, investigations like uh, glomerular filtration rate, um, serum creatinine, electrolytes, potassium level, calcium level, and so on. So uh, to find so this thing will determine how much the kidney is damaged. For example, the albumin and creatinine ratio in the urine will show how much the kidneys are being damaged. The kidney diseases, of course, staged into 5 stages. So when the patient gets kidney issues, actually we will have to start the patient on ACE inhibitors, which will help to prolong the progression of the kidney disease. So this involves other things like reducing the salt, reducing the protein in the food, reducing the potassium containing food in the patient's food, also important. And also it involves medications. So these things could be prevented if the blood sugar levels are properly controlled by the patient. This is what I have been telling in the previous video about diabetes. So once the kidney issue comes, if it is not under control, not treated well, if the patient is not following up properly, then kidney failure would happen. In that case, of course, uh, kidney dialysis has to be done for the patient, ultimately ending up in kidney transplant. But all are not lucky. It's kidney dialysis is very expensive, unless otherwise it is covered by the health insurance. The patient has to pocket it out. It costs about thousands of dollars to the patient. And so in Sri Lanka, of course, we don't have dialysis in all the hospitals. So in the private hospitals, it's very expensive. So it's prevention is the best thing. You have to prevent kidney damage by controlling your blood sugar levels properly. Kidney issue is a big issue. Many people die because of kidney failure. So along with kidney failure, a lot of things happen. Because the kidneys can't excrete the bad material produced by the body. So a lot of potassium, creatinine, urea, and all kind of things accumulate in the body and cause a lot of issues, and patients die of this. So dialysis is done to purify the blood, but how long a patient could go on? So it's a very big issue. involving the patient, the family, the community, the healthcare system, and so on. So it's better to prevent these things happening. So what I stress here is to, for if a patient is diagnosed as diabetes patient, then of course the patient has to control their food intake. Lifestyle modification is very important, and then proper follow up with the doctor, and then proper follow up with fasting blood sugar, and then proper medications as prescribed by the doctor are all important. It's better not to play around with diabetes. It's a dangerous disease. So I think this video would help you all, and I will be talking about obesity in the next video. Thank you very much.